Hello everybody, welcome back to my YouTube channel Physio's Healing Touch. So in this video I am going to demonstrate stretching of all the neck muscles, and in case if you are also interested to know about the lower limb stretching, then I have already uploaded video for the same. I will share the link so that you can watch it later. So now let's start the video. So first I will show you stretching of trapezius, basically upper trapezius. So in stretching, basically we perform the just opposite function of that muscle to stretch that muscle efficiently. So the function of trapezius is at the cervical level, it does the ipsilateral lateral flexion. Ipsilateral means if my right side trapezius is contracting, then it will do lateral flexion at the right side. So this is ipsilateral lateral flexion. And at the scapular level, it stabilizes the scapula and lift the scapula as well as adduct the scapula and upwardly rotate the scapula. Upper trapezius muscle is also an accessory muscle for the respiration and assist in deep inhalation. Now let me demonstrate the stretching of upper trapezius on a patient.
So patient will be in supine line and we have to support the head of the patient against gravity, and with our other hand we have to stabilize the shoulder. So in this case I am stretching the left trapezius muscle. To stretch left side, perform contralateral lateral rotation to stretch that muscle and also push the shoulder downwards to bring the insertion away from the origin to stretch that muscle efficiently. You can hold that stretch for, like in starting you can hold it for 20 seconds and later you can progress to 30 seconds, and repetitions will be 3 repetitions or 4 repetitions.
Now the next muscle is Levator scapulae. Now the stretching of Levator scapulae is very important, especially in those patients who have poor posture, because those who has poor posture, the Levator scapulae, which is present somewhat here, becomes tight. Especially in those patients who work hours on their computers or use mobile phones, then the Levator scapulae becomes tight. So it becomes important to stretch that muscles, and you should know the proper stretching of Levator scapulae muscle. Now the function of Levator scapulae is at the cervical level. If my right side Levator scapulae is contracting, that means unilateral contraction, then it will produce lateral flexion, ipsilateral lateral flexion. And if my both Levator scapulae is contracting, that means bilateral contraction, then it will produce extension of the cervical joint. At the scapular level, it lift the scapula, abduct the scapula as well as inferiorly rotate the scapula. Just like upper trapezius, Levator scapulae is also an accessory muscles of respiration and help during the deep inhalation. Now let me demonstrate you the stretching of Levator scapulae on patient.
In this case I am stretching left side Levator scapulae, and to stretch it, first I will support the head of the patient against gravity, and then I will perform just opposite functions of Levator scapulae. So I will do contralateral lateral rotation and then flexion movement. So in this way this movement resembles as if patient is looking at his pocket. So we can also tell the patient to look at his pocket, and we can also push shoulder downwards with our thenar eminence to bring the insertion point away from the origin to give an effective stretch. You can watch it again to acquire a better understanding. The most important thing during cervical stretching is you don't have to give a forceful stretch or aggressive stretch, because these muscles are very tiny and you can injure the muscle of the patient. So just give a gentle stretch.
Now the next muscle is SCM, Sternocleidomastoid. As the name says, start from the manubrium sterni and medial part of the clavicle and ends at the mastoid process. So the stretching of the SCM is especially important for those patients who have poor posture, upper cross syndrome. So in those patients, SCM do overwork, and because of overwork, it becomes tight. So especially in those patients who has poor posture, the SCM stretching is especially important. So the function of SCM is, as it starts from here and ends here, so the contraction will produce ipsilateral lateral flexion as well as contralateral rotation. So it does contralateral rotation but ipsilateral lateral flexion, and if both the SCM will contract, it will produce flexion at the cervical level and extension at the head at the same time. Just like other muscles, it is also an accessory muscle and helps during the deep inspiration.
To stretch the SCM, the patient will be out of the couch, his head will be out of the couch, and tell the patient to stabilize the medial portion of the clavicle and push it downwards to give an effective stretch of the SCM. Now to stretch the SCM, perform just opposite functions of that. Perform contralateral lateral flexion and ipsilateral rotation, and then extend the cervical spine. At the same time, push the clavicle downward to produce effective stretch. Now there is one important thing that you should know before initiating this stretch. The stretch can compress vertebral arteries on the opposite side of the stretch, and it can result in dizziness in the patient. So always perform orthopedic test first to check out if there is any kind of vertebral artery compression, and then you are good to go. You can perform this stretch.
Now the next muscle is scalene muscle. So basically scalene muscle has three fibers: scalene anterior, scalene medius and scalene posterior. So to stretch each and every fiber of scalene muscle, we use three different positions to stretch each and every scalene muscle. So I will tell you each and every position. And the reason why it is important to know the stretching of each and every scalene muscle separately, because in forward head posture looks somewhat like this. So in these posture, the anterior scalene muscles spatially become tight. So it is important to stretch only the anterior scalene muscle in forward head posture, while the posterior scalene muscle become overstretched. So there is no need to stretch posterior scalene muscle in forward head postures. That's why you should know the stretching of each and every fiber separately. So the anterior scalene muscle does the function of lateral flexion, ipsilateral lateral flexion, and when it will contract, it will produce the contralateral rotation, as well as when there will be bilateral contraction of the scalene muscle, it will flex the cervical spine, and as it attaches to the first rib, it also elevates the first rib and help in deep inspiration.
The patient will be well out of the couch and support the head of the patient against gravity. Ask the patient to stabilize his first rib for proper stretch. Then properly extend the head as far as possible, and then perform contralateral lateral flexion and ipsilateral rotation. And then keep stretching the anterior scalene diagonally and maintain the stretch. Stretch it for 30 seconds and perform 3 repetitions.
Now the medial scalene muscle does the function of ipsilateral lateral flexion, and it also attaches at the first rib, so it helps in the elevation of the first rib and helps in the inspiration.
Now for its stretching, stabilize the first rib, and you can also push it down for a better stretch, and then perform contralateral lateral flexion. This will stretch the medial scalene muscle.
Now the last is posterior scalene muscle. So posterior scalene muscle does the function of ipsilateral lateral flexion as well as ipsilateral rotation.
Posterior scalene muscle attaches at the second rib in contrast to the anterior scalene and middle scalene, which attaches at the first rib. So to stretch scalene, perform opposite functions like contralateral lateral flexion and contralateral rotation. So both will be in opposite side and stretch the posterior scalene. You can also stabilize the second rib because it is not palpable easily, so you can just stabilize the shoulder and push it, and you can stretch the posterior scalene.
So the last muscle group is suboccipital muscles. So as the name says, it lies just below the occiput. So just below the occiput, here, this area, in this area, the suboccipital muscles lie. So these muscles are rectus capitis, posterior major and minor, and obliquus capitis, superior and inferior. So together, when all these muscles will act, it will produce extension of the cervical spine, and these muscles, suboccipital muscles, spatially become tight in those who has forward head postures. So you can see forward head posture can lead to tightness of so many neck muscles. So basically when we are sitting like this, then these muscles, because our neck remain in extension continuously, so these muscles become tight. So that's why to stretch these muscles, first we will retract our chin. So we will retract our chin fully. So you can see when I am retracting my chin, these muscles are already stretching a little bit. So I will retract my chin and then I will do forward flexion. In this way, there will be excessive stretching of these muscles. In the same way, if you want to stretch the right side occipital muscles, then first you need to rotate towards the left and then you need to retract your chin, and then in the same way you will do a slight forward flexion of your cervical spine. And if you want to stretch the left side, then you need to rotate towards the right and then you have to retract your chin and then forward flex your cervical spine. So in this way you can stretch the occipital muscles. So now let me demonstrate it on a patient.
Even in some cases, if suboccipital muscles are tight, then it can lead to headaches in that patient. So suboccipital muscles are sometimes culprit of headaches. So it is especially important you should know the correct method of stretching suboccipital muscles.
So if you found this video helpful, then please like, share and subscribe to my YouTube channel, because your like and your comments means a lot to me. It motivates me to keep uploading my videos. So please like my video and give your lovely comments. Thank you.